Hi, I'm Dr. Shea Andrews from the University of California, San Francisco, and welcome to my poster looking at the genomic-informed dementia risk reports for personalised brain health. So genomic-informed risk reports are a novel way for integrating genetic and clinical risk factors to identify who is susceptible to developing dementia and what clinical actions they can take to reduce their risk. So ideally, we can report back these genetic results in midlife before blood-based biomarkers become elevated to focus on prevention, like they've been doing in the US pointer trial. And when blood-based biomarkers become elevated, we can shunt patients off into a dementia specialist clinics. But to use these genomic-informed dementia risk reports, there are a couple of questions we need to answer. First of all, what polygenic risk scores should we be using across diverse populations to make sure that they're equitable? So in our first analysis here, we compared 5 different polygenic risk score methods that integrate in about 1 million genetic variants to predict dementia risk. And what we found is that our cross-ancestry method was predicting risk across all 3 of our 4 populations, while our single ancestry methods had less predictive performance. Similarly, when we use clinical risk scores, they integrate in cardiovascular risk factors, age, and sex. There are several different ways we can use this, and the first one that we used was the CADE risk score that was developed in a Finnish population. However, unfortunately, it had race and ethnicity-specific effects when applied in US population. When we used a modified version that was recalibrated for the US population, we had it been associated with increased risk across all 4 of our populations. We then next wanted to see how many people would be at increased risk when we combined our clinical risk scores, polygenic risk scores with ApoE and family history. We find that nearly 80% of the people in memory and aging clinics at least have one of these high risk indicators, highlighting that there are a number of participants that we can focus on for prevention. And when we look at how many of these risk indicators you have and your probability of transitioning to dementia, we see a dose-response relationship where if you have up to 4 of these risk factors, you have nearly a 12-fold increased risk of developing dementia. Okay, so in conclusion, we can use these integrated genetic and clinical risk profiles to identify who is vulnerable to dementia in midlife to focus on prevention to promote brain health.